Hi, my name's Christina. I'm the nurse today. Um, I have been instructed to provide you with a head to toe assessment. I do see here some friends and family members. Would you like them to stay or would you like them to step out as we do a head to toe assessment that would provide us a baseline of your overall current health? Okay, you want them to step out? We have them step out. We provide the patient with patient privacy. And is it okay if I touch you? Okay. I am going to go ahead and perform hand hygiene before touching the patient. And may I get your name and date of birth? Her name and date of birth match. Thank you. Can I address you as Minnie? Yes. Okay, Minnie Mouse. Um, may I ask what we're doing here? Yes. Okay, and her where we're at? Yes. Okay. Who's the president? Okay. So in the meantime, I am assessing the patient. She is alert times four. Um, I am gonna assess in the meantime while she's talking if there's any involuntary movement, is any drooping of the face. Um, I'm gonna go ahead and so as I said before, I'm going to do a head to toe assessment. During the head, I am going to go ahead and assess and palpate the head and the skull. Um, what we're looking for is we're looking for the patient's basically shape, size. Um, does her face match her body size? Those type of things. So while we're here, we also want to assess cranial nerve number 7. We're going to ask her to puff her cheeks, smile, frowned, and close her eyes tightly. And when the patient's able to do all that, cranial nerve number 7 is intact. Now we are going to go ahead and assess her hair. No, her hair, we require the color, the quality, the distribution, the texture, the shape, assess for any infestation, masses, um, skin breakdown, and alopecia. So the patient has a full set of hair, so we can move on to maybe assessing, since we're there, the temporal arteries, and we do palpate those bilaterally. The patient has 2 plus. Let's go ahead and have her assess cranial nerve number 5. Go ahead and back down. And what we're going to go ahead and do is we're going to feel the master muscle, then the temporal. Then we're going to go ahead and have the patient open their mouth against resistance. And we're going to check the temporal mandibular joint. And what we have them do is open and close their mouth like so and check for any grating or clicking sensation from the patient. And then once we're there, we can move on to something different. Like, since we're already here, we can do the palpation of the sinuses. And this would be the frontal and maxillary. Let me know if anything hurts, and nothing hurts. Um, Next, we would look at her eyes. And what we're looking here is we're looking at the sclera, the white of her eyes, the iris, no eyelid swelling. Also, of course, that there's no jaundice, no erythema. On the pupils, we're looking for equal, no strabismus, no aniscoria. Okay, basically what we're looking for is that they're normal, anywhere between 3 to 5 I always want to say milliliters, but it's millimeters. And also we're looking at her conjunctiva, that it's nice and pink. Okay, now, um, um, okay, so next we're gonna go ahead and check her that there's no nystagmus. So we're gonna go ahead and have her follow the pen, and we go through the 6 cranial fields of gaze. And what we're looking for is we're looking for any involuntary shaking of the eye. Okay. Um, Also, once we do that, there was no involuntary shaking of the eye. She's good. We need to check for that the pupils are reactive to light. That means that um, they become smaller as light hits them. So what we do is we dim the lights and we put light into the patient's right eye or left eye, and we expect both of them to react. Okay. We also test for test accommodation. And what we do is we have the pen about 14 feet, 14 inches from the nose, and we simply bring it closer and closer and closer to the patient. And what we're looking for there is accommodation. Now the patient here, Minnie Mouse, is good. So she has Perla, which is equal, round, reactive, and accommodation. Okay, so basically with her eyes we're good. We will move on to something different like her ears. Okay, and right now we're just focusing on the top of her head. Okay, we're gonna go ahead and check her ears. And Minnie Mouse, let us know if it hurts you. But first, we would inspect the ears, look for any up, abnormalities, basically, any redness, any drainage, any that she has no toffee. Next, we would palpate the ear. Let me know if you feel any pain, Minnie Mouse, and she doesn't feel any pain. Palpate the palpating the mass process back of the ear. Okay, we would use our otoscope. This is as close as an otoscope as I could find for the tympanic membrane, and what we're looking for is a pearly gray, transparent color, shiny. In her ear. Okay, the cone of light will be anywhere at 5 o'clock in the right ear, 7 at the left ear. Okay, and then we're also going to go ahead and check her cranial nerve number 7 here. And what we do is we simply close one of her ears and we whisper pink apple, and she is able to hear pink apple. Yellow banana, and she is able to hear the yellow banana. So here the ears would be considered intact, and then we would move on to her nose. And I'm sorry, we wouldn't touch our faces. No. Okay, so we would go on to her nose. We would first inspect the nose before we touch it. Is it midline? Can we go ahead and see any obstruction, any drainage? Do you have any discomfort in your nose, Minnie Mouse? No. Okay, so what we would have them do is we would have them close one nostril and breathe on the same air. The airflow is patent, so it's good. We'll do the same thing to the other side. Now we look inside her nose, and once again we're looking for any abnormalities, a deviated septum, anything like that. Here we would check cranial nerve number 7, and the way we would check cranial nerve number 7 is we would have Minnie Mouse smell it, and obviously close her eyes, smell it, and she does state that it is lavender. And if we move, and cranial nerve number 1 is intact. Okay, so we will move on. And of course, everything afterwards, we're going to go ahead and notate the. Okay, here we're going to go ahead and inspect the lips next. Okay, basically we're going from head to toe. We're inspecting the lips for pink, that they're not blue. If they're blue, we want to go ahead and make sure that could be lack of oxygen. If they're cracked, it could be dehydration. We're going to go ahead and check for cranial nerve number 12, and what we would have them do is simply stick out their tongue and just move them from side to side. We would look inside her mouth for any lesions, also just overall hygiene, if she's missing any teeth, if she's has any cavities. We would have her also stick out her tongue and check her gag reflex, and it's good. We would check her uvula, that it is midline, and she is good. When we check the Gag reflex, don't forget we're checking on cranial nerve number 9 there. And then as far as cranial nerve number 10, you are observing it while you're testing the patient. You know what? She's able to talk. Is she able to swallow? Cranial nerve number 10 is intact. Okay, so moving on, we would check on her neck. Okay, here we're going to go ahead and check the carotid artery. And here we're not going to go ahead and do it bilaterally like we did it last time. We're going to do one at a time. Okay, we're also observing first that the trachea is midline, no lesions, no goiters. We want to test cranial nerve number 12, and what we do is just have the patient move the head from side to side, up and down, and then against resistance. We also want to go ahead and check the jugular vein. Now, for the jugular vein, make sure that the patient's face is at a 45-degree angle to go ahead and test for that. And you know what? Minnie Mouse is perfect. We're going to go ahead, as I said, we're going to go ahead and palpate the trachea. Just that it is midline right here. Do you feel any tenderness, Minnie Mouse? Okay. We're going to palpate for lymph nodes. And then we tell her, do you feel anything? Let me know if you feel anything. Okay, and we start actually at the front of the ears, but Minnie Mouse's ears are all the way up here. Okay, but Minnie Mouse's ears are over here, so we start at the front of the ears. Then let's see here. Okay, let's move on to the upper extremities. Okay, and let's perform hand hygiene every time. Change gloves because we're moving to a different part of the body. Okay, so perform hand hygiene. I'm sorry. Assess any redness in her, any swelling, any edema. We want to go ahead and do that. First, we're looking at them, any cuts, anything, any abnormalities. Then we palpate the radial artery, and hers are 2 plus. We're going to go ahead and check for capillary refill. Okay, and her capillary refill is less than 2 seconds. We're going to go ahead and check skin trigger on her. And she's good. We're going to go ahead and look at her joint range, and she's just fine. Okay, then we're going to go ahead and check the brachial arteries as well in 2 plus. Okay. We check the, okay. Can I have you squeeze my fingers as hard as you can? And you know what? She is able to squeeze my fingers. She's really, really strong. She has a 5 plus. And we're going to go ahead and feel her elbow for movement. And then here we're going to, before we move on, we're going to go ahead and check her drift. And what we have them do is just stand up. They're going to do this with their eyes closed. We don't expect that. We expect just simply like that. If we do see that, maybe it's a sign of a previous stroke. Okay, now let's go ahead and do the abdomen or the chest. Okay, and here we're going to go ahead and be looking for any abnormalities once again, any wounds. Also inspect the patient for effort of breathing. In COPD patients, you can have what's called the barrel chest. Okay, while we're here, we want to go ahead and listen to her heart. Okay, and basically what we're going to go ahead and do is we're going to go ahead and listen to the aortic right at the sternum border at the second intercostal space. And what you're going to go ahead and hear is love duff S1, S2. Okay, and we run right across, okay, to the left side. Same thing, second intercostal space, but to the left. And you're going to listen to the pulmonary artery. Okay. Then we go down to the tricuspis. The tricuspis, you're going to go ahead and listen to S1, and it will be the loudest there. Okay, then which point you're gonna move on to the apical pulse, and there is the apical pulse will be love, dove, and S2, and that is anywhere between 60 to 100, um, anywhere between 60 to 100 beats, and that one will be at the fifth intercostal space. Okay, and you know what? Her heart sounds great. So why don't we go ahead and listen to her lungs now? Okay, and the way we're going to go ahead and listen to her lungs, we're going to go ahead and start at the apex of the lungs and then down to the. Okay, so it's going to be basically an S here. So apex of the lungs, down to her, then down to her second intercostal space. Okay, and then once again, we're doing an S so we don't forget. Okay, then to the fourth intercostal space, and then finally, this or then we move on to the sixth intercostal space, mid axillary. Okay, and basically, her lungs sound clear with no abnormalities. And then we're going to go ahead and do the same thing to the back, but don't listen over the scapula because you're not going to listen to anything. You just need to be more towards the middle, okay? And basically, you're going to go ahead and do the same thing. And then, perfect. Okay. Okay, Minnie Mouse, thank you so much. Now we're going to go ahead and listen to the abdomen. Now, the abdomen is going to be a little bit different because we're going to inspect, then auscultate, then percuss. Okay, and the reason we're not going to go ahead and do it in the other order is because we don't want to stimulate any unnecessary sounds. The patient will lay flat on their back. Okay, and for any change of body parts, I'm going to go ahead and perform hand hygiene, okay, and change gloves and so forth. Okay, and you asked them, are you having any issues? When was your last bowel movement? How are you urinating? If it's a man, are you having trouble starting a stream? If it's a female, when was your last menstrual cycle? Okay, you're going to be able to notate if there's any pulsation, if there's any hernia, any wounds. Okay, now we're going to go ahead and listen to the bells. The bells should be anywhere between 5 to 30 sounds per minute. Okay, anything below or above that would be hypoactive or hyperactive. And we're going to go ahead and divide it by 4 quadrants, okay? And we're going to go ahead and start in the right lower quadrant, okay? And then we start in the right lower quadrant, and then as we listen to it for 1 minute. If we hear no sounds, then we listen to it for 5 minutes. And then next we would palpation of the stomach. Okay, but Minnie Mouse has no abnormalities with her stomach. So we're going to go ahead and move on to her legs. So we're going to go ahead and move on to a different body part. So we're going to go ahead and once again perform hand hygiene, change gloves, put new gloves. And here we're going to go ahead and notice that she has normal hair growth, no swelling, no pain, no redness, no edema, no shininess of the legs. Here, well, as we're looking at that, we're also looking that she has no wounds, nothing abnormal. Okay. Here, I would like to point out that we also check the capillary refills, just like we did with the hands. We go ahead and touch each and every one of them. Okay, and each one goes back to less than 2 seconds. So she is good. It's immediate. Okay, we're gonna go ahead and check the pulse here. Okay, and we're gonna check them in different locations. Okay, behind the knee, the popliteal pulse. Then we're gonna check the posterior labia. Okay, tibia. And then we're going to go ahead and check the dorsalis pulse, which is on top of your foot. Okay, and she's she has a plus everywhere. Okay, she has a 2+ everywhere. Um, and then we're gonna go ahead and check for movement. Have the foot pressed against resistance, and then have her move, and she's good. Here we're gonna also do the Babinski reflex, okay? And the Babinski reflex, basically we take and we go up. Okay, what we're expecting is the patient to curl her feet, and that would be a negative Babinski reflex, which is good. Okay, and now I'm gonna go ahead and change my gloves once again because we're moving to another part of the body. Okay, and change gloves, perform hand hygiene. Basically, what we're going to go ahead and do is we're going to inspect the breast. Okay, and you could have done it when we were at the chest section, or you can do it separately. You're going to divide the breast into quadrants once again, inspect the breast for size, symmetry, shape, position the patient now in laying position as we just have, and have them raise their arm above their heads. And we're going to go ahead and start all the way from the axillary, and we want to go ahead and make sure we cover everything. Okay, once we check the breast, we also do ask if they have any abnormalities, if you feel any tenderness or anything like that. Since this patient does not feel any tenderness, we do go ahead and move on to the next one. And once again, we perform hand hygiene because we are moving on to something different. And what we're going to go ahead and move on to is we're going to move on to the privates. If it's a female, what we're going to go ahead and do is we're going to go ahead and once again ask them about their menstrual cycle. We're going to go ahead and ask them how their flow is. We're going to go ahead and ask them their flow. We're going to ask them how many pregnancies, how many live pregnancies, how many all that information. If she's a regular, when did she start her menstrual cycle? When was her last menstrual cycle? I think I already repeated that. And we're just going to go ahead and ask her all these questions. Okay, we're going to go ahead and inspect for any drainage or anything like that. We're going to ask her if she has any tenderness. We do open her labia and labia minora to go ahead and inspect there. Okay, but Minnie Mouse is good. Now, if Minnie Mouse was a female, then what we do is same thing. We ask them if they're having any trouble urinating. We do want to go ahead and ask them if they're starting a flow, right? We want to go ahead and inspect that there's no swelling or anything like that. If it's uncircumcised, if the male is uncircumcised, make sure you remove the skin and make sure you put it back when you're assessing the patient. Okay, and once again, for that, you must wear, since it's a new part of the body, new gloves, new hand hygiene. Now, at this point, let's go ahead and change gloves. Go ahead and perform hand hygiene again, because you know what? We also do need to go ahead and check her back. And here we're inspecting the back. We're inspecting, we're asking the patient when was their last bowel movement, and things like that. We want to go ahead and make sure there's no hemorrhoids or anything like so. Okay, and once we're done, we've removed gloves, perform hand hygiene one more time. Okay, and we make sure our patient is at a comfortable position. Minnie Mouse, are you comfortable currently? Yes, okay, perfect. And Minnie Mouse, we did a head to toe assessment. This information will be related to your doctor. I will go ahead and notate this in your chart. Is there any questions or concerns I can address for you today? No? Okay, thank you very much. I'll be outside. She's at the lowest position. Her call bell is within reach. And we've concluded a head to toe assessment.